CEN test prep exam topics. Question 1. Which finding on end-tidal CO2, EtCO2, monitoring indicates successful endotracheal intubation? Option A, the EtCO2 of 0 mmHg. Option B, persistent EtCO2 waveform with each ventilation. Option C, PtCO2 of 50 mmHg. Option D, a flat line waveform. The correct answer is option B, persistent EtCO2 waveform with each ventilation. Question 2. A 25-year-old female presents with sudden, severe unilateral lower abdominal pain and vaginal spotting. She has an IUD. The nurse's priority is: Option A, obtain a urine pregnancy test. Option B, administer pain medication. Option C, prepare for pelvic exam only. Option D, discharge with follow-up. The correct answer is option A, obtain a urine pregnancy test. Question 3. A patient with anaphylaxis develops acute respiratory distress, wheezing, and hypotension. What is the priority medication to administer? Option A, albuterol nebulizer. Option B, intravenous diphenhydramine. Option C, intravenous corticosteroids. Option D, intramuscular epinephrine. The correct answer is option D, intramuscular epinephrine. Stressed about your CEN exam? We can take CEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 4. Which finding is consistent with an anterior shoulder dislocation? Option A, arm held in internal rotation and adduction. Option B, arm held in external rotation and slight abduction. Option C, patient unable to flex the elbow. Option D, numbness of the medial forearm. The correct answer is option B, arm held in external rotation and slight abduction. Question 5. A patient presents to the emergency department with a laceration that requires sutures. During the procedure, the patient states they feel faint. The nurse's first action is to: Option A, administer oxygen. Option B, place the patient in Trendelenburg position. Option C, immediately discontinue the procedure. Option D, assess vital signs. The correct answer is option C, immediately discontinue the procedure. Question 6. A patient with a traumatic brain injury exhibits decerebrate posturing. This indicates: Option A, a damage above the midbrain. Option B, a damage at or below the midbrain/brainstem. Option C, damage to the cerebral cortex. Option D, a positive outcome. The correct answer is option B, damage at or below the midbrain/brainstem. Question 7. A patient with known cirrhosis presents with massive hematmesis. The nurse suspects bleeding from: Option A, peptic ulcer. Option B, esophageal varices. Option C, a hemorrhoids. Option D, Mallory-Weiss-Tear. The correct answer is option B, esophageal varices. Question 8. A patient with acute respiratory distress has the following arterial blood gas: pH 7.22, PaCO 258, PaO 262, HCO 324. This represents: Option A, uncompensated respiratory acidosis. Option B, compensated respiratory acidosis. Option C, uncompensated metabolic acidosis. Option D, compensated metabolic acidosis. The correct answer is option A, uncompensated respiratory acidosis. Are you looking for CEN exam actual questions? Visit our website pokerexams.com to access CEN exam study guide with actual questions and answers. Scan the QR code or click the link in the description to get CEN exam answer key today. Question 9. A patient presents with a painful, red eye, cloudy cornea, fixed mid-dilated pupil, and increased intraocular pressure. The nurse suspects: Option A, open-angle glaucoma. Option B, acute angle-closure glaucoma. Option C, a conjunctivitis. Option D, uveitis. The correct answer is option B, acute angle-closure glaucoma. Question 10. What is the classic sign of a basilar skull fracture? Option A, Battle's sign, mastoid ecchymosis. Option B, rhinorrhea with glucose-negative fluid. Option C, a hemotympanum. Option D, all of the above. The correct answer is option D, all of the above. Question 11. Le Fort fractures are classifications of fractures of the option A, mandible, option B, mid-face and maxilla, option C, orbit, option D, nasal bones. The correct answer is option B, mid-face and maxilla. Question 12. A patient with a history of alcohol abuse presents confused and ataxic. To rule out Wernicke's encephalopathy, the nurse should prepare to administer option A, folic acid, option B, a vitamin B12, option C, thiamine, option D, magnesium sulfate. The correct answer is option C, thiamine. Question 13. The antidote for acetaminophen overdose is option A, naloxone, option B, N-acetylcysteine, option C, flumazenol, option D, sodium bicarbonate. The correct answer is option B, N-acetylcysteine. Question 14. A patient presents with costovertebral angle tenderness, fever, chills, and dysuria. The nurse suspects option A, cystitis, option B, pyelonephritis, option C, nephrolithiasis, option D, renal artery stenosis. The correct answer is option B, pyelonephritis. Question 15. Which type of shock is characterized by decreased cardiac output, elevated systemic vascular resistance, SVR, and jugular venous distension? Option A, hypovolemic shock, option B, distributive shock, option C, cardiogenic shock, option D, neurogenic shock. The correct answer is option C, cardiogenic shock. Question 16. In distributive shock, the primary pathophysiology is option A, pump failure, option B, widespread vasodilation and increased capillary permeability, option C, fluid volume loss, option D, obstruction of blood flow. The correct answer is option B, widespread vasodilation and increased capillary permeability. Question 17. A nurse witnesses a colleague diverting narcotics. What is the appropriate initial action? Option A, confront the colleague directly. Option B, report the observation to the charge nurse or manager immediately. Option C, document the observation in the patient's chart. Option D, call the police. The correct answer is option B, report the observation to the charge nurse or manager immediately. Question 18. A trauma patient with significant blood loss is in decompensated hemorrhagic shock. Which finding would the nurse expect to see last, as a very late sign? Option A, tachycardia. Option B, narrowed pulse pressure. Option C, hypotension. Option D, tachypnea. The correct answer is option C, hypotension. Stressed about your CEN exam? We can take CEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 19. A patient with a Le Fort 3 fracture is at highest risk for option A, dental malocclusion, option B, airway compromise, option C, corneal abrasion, option D, temporomandibular joint dysfunction. The correct answer is option B, airway compromise. Question 20. The safe harbor provision for nurses typically refers to option A, a law that provides legal immunity in all circumstances, option B, a process where a nurse can request a peer review of an assignment they believe is unsafe without immediate fear of retaliation, option C, a hospital policy allowing nurses to refuse any assignment, option D, the requirement to report all medication errors. The correct answer is option B, a process where a nurse can request a peer review of an assignment they believe is unsafe without immediate fear of retaliation. Question 21. The best method to remove a prosthetic eye in an emergency is option A, using forceps to grasp the prosthetic, option B, applying suction with a bulb syringe, option C, using a suction cup designed for prosthesis removal, option D, sweeping a finger around the edge to break the suction. The correct answer is option C, using a suction cup designed for prosthesis removal. Question 22. A patient is brought in with decreased consciousness after being found outside in cold weather. Core temperature is 30 degrees Celsius 86 degrees Fahrenheit. What ECG change is the patient most at risk for? Option A, atrial flutter. Option B, prolonged QT interval. Option C, Osborne, J, wave. Option D, ST depression. The correct answer is option C, Osborne, J, wave. Question 23. A patient with a pulmonary embolism is at highest risk for which immediate complication? Option A, pulmonary fibrosis. Option B, right ventricular failure. Option C, left ventricular hypertrophy. Option D, atelectasis. The correct answer is option B, right ventricular failure. Question 24. A patient with acute pancreatitis should have which nursing intervention as a priority? Option A, encourage early ambulation. Option B, keep the patient NPO and provide aggressive fluid resuscitation. Option C, administer high-fat diet. Option D, restrict all 4 fluids. The correct answer is option B, keep the patient NPO and provide aggressive fluid resuscitation. Question 25. A patient receiving intravenous nitroglycerin for chest pain develops severe headache. The nurse should: Option A, stop the nitroglycerin infusion immediately. Option B, administer morphine for the headache. Option C, treat the headache and continue nitroglycerin as ordered. Option D, switch to oral nitrates. The correct answer is option C, treat the headache and continue nitroglycerin as ordered.